called Sterile Preparation for Immediate Use. And today we're going to review how to mix a mini bag using a glass ampule. For immediate use, that means 1 hour max of preparation time. 6 hours is the maximum time from the time of start to when the IV needs to be completed. So there's a few things that we need to review here. One is preparing our sterile area. So we're going to clean with 70% isopropyl alcohol. We're going to wipe it with a cloth. Let it air dry. So this is our preparation area. Of course, you're going to be washing your hands. You can use soap and water at a sink, or you can use alcohol gel. Being careful to get under your nails, in between the fingers, etc., etc. Another important thing, you must clean the neck of your ampule with an alcohol swab, because this glass outer area is a source of contamination. You want to reduce the likelihood of bacterial growth as much as possible when you're preparing admixtures for immediate use under these conditions. Put a few alcohol swabs on your tray. The next thing is you want to grab a mini bag. We're going to use a 50 ml NS bag, and what you want to do is give it a quick wash with alcohol. Presumably it's been sitting on the shelf. Down. Put an alcohol swab beneath it. Actually, cleanse, cleanse, cleanse. Put your alcohol swab down. The package that I removed it from has a date opened. I want to make sure that the expiry from the time I opened the sterile packaging is within the facility's beyond use dating. In our case, we have 30 days to use up the mini bag from the time we open the package. You want to prepare your medication added label. You have two choices. You can manually write it on a medication added, or you can use your printout from the ADU. Either way, the sticker must have the patient's full name, the medication, the strength of the medication, and it's very important that you indicate your beyond use dating. So bearing in mind the 6 hour window that your IV is good for once you've began the preparation of the medication. So also an initial of your name. So on the ADU sticker, that information is in the bottom corner here. Okay, next at our facility we have an Ampoule Breaker, which is very useful in preventing a Sharps injury. So you want to make sure that there's no medication up in the neck part, so give it a little tap, break it off, immediately into the Sharps, and put it down on your clean prep area. We have two types of blunt fill needles. We have one with a filter, it has a purple end, and one without a filter, has a red end. When you're drawing up from a glass vial, you want to use the filtered needle. That way any microparticles of glass will be trapped in the filter. You want to switch needles before you inject your medication into your mini bag, because you don't want to put your glass that you just drew up and it collected in the filter, you don't want to put that glass shards now into your mini bag. So next step, grab your syringe, grab your filtered needle, being careful at the critical points not to contaminate. Open and open. You're not touching. Screw it on. Now that you have the needle on the end, you can do a few manipulations just to loosen up your plunger, being careful not to touch this section of the plunger. Now, the correct way that I learned is that you flip your bottle upside down, draw it out. After many years of nursing, I'm still not able to manipulate that well. So what I do is I go straight into my vial here, and then I've got two hands to be able to draw up the medication. So this is a 1 ml vial. Just want to make sure you have your 1 ml. Once you do, you're going to discard your filtered needle. Being careful not to contaminate your critical points. Put on a fresh, non-filtered needle. I believe I already wiped my mini bag port, but just in case you can't do it too many times, here. And then aiming for the middle, being careful not to puncture the side of the mini bag. You want to go release your plunger and then straight out and straight into the sharps. Now you have your mini bag with your medication in. Your medication added is on there, it's filled out. Your glass ampule should go straight into the sharps as well. At this point, you can now use your secondary set and prepare that here in this clean area rather than at the patient bedside. You've got two caps, one on the patient end, one on your spike. Remove your cap from your mini bag. You want to before you flip, you want to make sure that your roller clamp is closed. Give it a few primes here. And then very slowly release your clamp and watch as the medication primes the line. Not too quickly or you'll lose all of your medication. It'll come blasting out at you. Okay? So you've got your medication, your stickers on, you've got a few alcohol swabs, because when you get to the patient's bedside, you want to clean the port where you're connecting your secondary line. So that is how you would prepare a mini bag without using a transfer device. You can use a maximum of 3 receptacles. If you are mixing into a mini bag, that would be 1 receptacle, 2 receptacles, 3 receptacles. If you had to put 3 vials in, you wouldn't be able to do that. The other rule that we have to comply with is that you can only have so many punctures per vial. So you would be allowed to puncture twice into this receptacle, 2 punctures in this receptacle, 2 punctures in this receptacle. By using the transfer device, which we saw in a previous video, that is the preferred method, and it allows for less punctures, less manipulations, less chance of bacterial contamination. The more vials that you're mixing, the more, with each puncture, you're increasing the chance of bacterial contamination. Do your usual rites of medication administration. You're checking your rates, you're checking your calculation, you're checking your orders, you're washing your hands and complying with all those other things that we need to think about as nurses.